So the FEMaLe project is an European Union funded project, and it's within this call, this specific call about personalized early risk prediction, prevention, and intervention based on AI and big data technologies. And this is, of course, very important in the general setting of the FEMaLe project, as this points towards innovation. And that is overall the ambition with this Horizon Europe program, to stimulate closer collaboration between universities and industry. So that's also why in the very title, the acronym, the FEMaLe acronym, and behind that, defining endometriosis using machine learning project, that we have a strong emphasis on innovation, on developing new products and tools. So first, I have a three-part presentation here. First, I'll introduce the project itself in the first part. In the second part, I'll go through our preliminary results. And in the third part, I invite you to take part in the next movement. Sounds good? So the FEMaLe project is about personalizing early risk prediction of endometriosis with an aim to ensure a more individualized intervention and to build knowledge for prevention by the identification of subtypes of endometriosis. So already here we have, as you mentioned, as you might recall with this specific call, a strong focus on prediction and prevention and intervention. So this is what we try to achieve with the project. And my way into this was totally coincidental. Before 2019, I have never heard about endometriosis, really. So it was really interesting for me, first of all, to explore what it was. And I was really intrigued and read something about an article in a monthly bulletin for general practitioners in Denmark, this huge diagnostic delay and how big of a problem that is. So I was really intrigued, and at the same time, I read some white papers about machine learning, and could machine learning actually propose a new way forward for identification of, let's say, in this case, it was actually rare diseases. So not the case for endometriosis as such, but I sensed there could be some interesting overlaps. So the idea with applying machine learning in this way was to identify patients with a disease in a wider population based on their medical history, and then based on those data, those digital footprints, to develop an algorithm to identify these unique patterns, and then ultimately to find and target such patients. So that was the initial idea here. Again, endometriosis not being rare as such, it's very prevalent, but widely underfunded, under-researched, under-diagnosed, as you all know. So that was the first concept that just came to my mind. And the second one is this graph here, kindly borrowed from our partner Precision Life. Can we move from population to precision medicine? And this is where the early risk prediction and the whole prevention comes into the picture. So the idea again being, can we explore a whole population using high resolution multi-omic analysis? So we combine various data, and then we try to identify in a stratified way, we try to group patients. Can we then target individuals better? Because right now it's one size fits all approach, and that means that many doesn't get the personalized treatment that could be offered. And in the case of endometriosis, of course, we don't have many options, but at least this more personalized approach could actually be interesting to explore. So that was the whole idea with this FEMaLe project, to utilize some of the principles from machine learning and algorithms together with the precision medicine approach, and then to apply this into the area of endometriosis. The ambition with the project is to develop a platform that converts these multidimensional population data sets into a personalized predictive model to improve the continuum of care for those with endometriosis. And this is kindly developed by Lone Hummelshøj, a very nice framework where we try to visualize how the concept of FEMaLe covers the whole pathway for the patient, especially going from symptoms, help-seeking behavior, should or should I not seek medical attention. And this is where we try to apply the Lucy application to guide patients if they should consult their GP or not. And then when they're being referred, can we then help clinicians better to stratify patients? Can we, based on a biomarker, put patients in a low or high risk group so that we only investigate those who actually require attention? And then down that road, can we then subgroup these patients based on their conditions? And this is where we are applying some machine learning to develop these tools. And then coming down through this pathway to the treatment and the surgeons and others there, we also try to explore who is responsive to which treatments. And this is where we have this vision tool for surgeons, and we also develop a mindfulness and acceptance-based digitalization of a digital intervention. And I'll go in depth with that in a second. So the idea with this being that we have this platform, this model established in the project, so that we can combine these various data sets and ultimately make a more tailored approach to this. And by doing so, we hope to enable more shared decision making. This is especially the case in general practice and primary care, but of course also in secondary care, so that we personalize the whole pathway more. A part of that equation being awareness raising. That's also why I'm here today. Can we increase health literacy in those with endometriosis? Can we actually contribute so that patients feel more empowered, and ultimately improve the quality of life in those with endometriosis? So the FEMaLe project is an EU-funded project. We got granted close to 6 million euros, and the project started off 1st of January in 2021. So we were still in the pandemic period. We actually conducted the project for 15 months before being able to meet in person in Aarhus. So it was a first for many of us to do it this way, but we have managed to also make great use of these digital opportunities. Today's webinar, a great example of that, I think. And what happened when we met virtually was that we asked all participants to basically come up with one word describing what it would take for us as a consortium in order to be successful. And those two major words that came up were that we need to have a collaborative approach to this, since we are so interdisciplinary, and we needed to stay motivated to have a lot of enthusiasm. And I'm just proud to say we had an executive board meeting just the other day that this is definitely still the case, even more than halfway through the project. We are 17 partners from 9 European countries, covering Scandinavia, Northwestern Europe, Southeastern Europe, Central Europe. So it's a great geographical distribution, and our partners covers universities, hospitals, companies, patient associations, civil society organizations, many various actors here. And it's a very wonderful team. So the project itself consists of 10 work packages. We have the core in the project, the research and innovation work packages from 3 to 8. So in work package 3, phenotype, this is where we do epidemiological studies, and we try to explore the actual prevalence of endometriosis and also update knowledge about social consequences, psychological consequences. And we look into registers in Denmark and in Scotland to do so. And right now we are also surveying, questioning 60,000 Danish women about symptoms, not only for endometriosis, but women's health in general, in order to hopefully learn more about relevant symptoms. And prior to this, we have conducted a consensus study on symptoms, and this will also be presented in Edinburgh. In work package 4, the omics work package, this is where we try to explore, are there any subtypes of endometriosis? And Karina Sunderman and team in Oxford have tried to explore this using the UK Biobank material. And then we try to replicate those findings in a Danish data set. And it's also really, really interesting. We have a company on board from the UK called Precision Life. And the idea with this being that we can use machine learning algorithms again to run these really high order analysis because it's big data looking into genetics. And we will also present more about this in Edinburgh. In work package 5, this is where we developed the Lucy app, again trying to identify any relevant environmental factors, have users to share with us information about. We have in this project, it was an existing solution. So in this project, we are adding to the app by setting up a questionnaire so that we can collect data using the app for research purposes. And we have also added 2 other modules, one about dietary and another one about physical exercise. So we are really trying to learn more about the users in the app this way. And the intention with this is to produce specific patient profiles by using this app. So we also hope that can be relevant in the clinical context. In work package 6 and 7, closely linked, this is where we try to explore whether we can, based on an algorithm that has been trained using images from surgeries that has been annotated by surgeons, can we then train an algorithm to ideally automatically detect endometriosis and classify the lesions? So that's what we are aiming to produce in work package 6. And the idea with that being that then the surgeon in work package 7 can be visually guided by a computer vision tool during operation. And that should, of course, let's say, compensate, especially if you're not an expert surgeon, not so many of those, then this tool could really, really assist the skilled, but maybe not senior expert surgeons this way. So very, very interesting approach. In work package 8, this is where we try to digitalize this My Endo program, and it's also going really well. And ideally, we'll link that program with the Lucy app down the road so that users have access to this. And I'll just come back to why this is important in a second. So these are the 5 or 6 core pillars in the project. And then around this, since it's such a large project, we also need to run things effectively. So we have work package dedicated to project management. Work package 10, this is what I'm doing. We have another one looking into communication, dissemination, exploitation of these results and innovations. This is work package 9. And in accordance with the European Union's visions of a open society, diversity, we have chosen in this project to emphasize ethics and open science. So this is what we're working on in work package 2. And now actually we are producing 3 parallel white papers to discuss and make a state-of-the-art description of these topics of ethics, gender, equity, inclusion, and open science. And then in addition to the project management, we have also emphasized that we wanted to monitor and assess the impact we create with this project. Bear in mind, it's an innovation-driven project here, and there are high hopes from the Commission that we really can produce some great innovations. So we have set up a dedicated system to track and monitor the progress and the impact we create. So this is also very exciting. So this was just boiling down the FEMaLe project in work packages, and a little bit more about the innovation outputs. So in work package 4 about genetics, we also want to prototype 2 clinical decision support tools, one for risk stratification, as I described, and another one about a multi-marker signature for endometriosis. And this is the first step towards identifying new drug targets. In work package 5, we have the Lucy app, as I mentioned, and we have already delivered 2 prototypes, 2 new modules. And down the road, we intend to convert these big data collected through the app through some of the technical universities we have on board, and then produce this risk profile that we can then use in a clinical context. In work package 6, we are producing this software based on a machine learning algorithm for the detection and scoring of endometriosis. And then in work package 7, this is going to guide surgeons suggesting the endometriotic resection zone, the division plane. And in work package 8, we are developing the MyEndo program and ultimately feeding that back into the Lucy app. So just a little bit about this real-time augmented reality tool. This in the bottom here, the normal public view. This is how it's normally visualized, but with the Surgear augmented reality tool, you can see that it's a 3-dimensional model based on the images scannings, and that will then be translated into the screen on the surgeries, and it's very innovative, I think.